Great. All right, well, welcome everyone. Thank you for joining this afternoon's webinar on assessing community readiness. My name is Claire Grace Jones, and I'm a training consultant and project manager with the Iowa Department of Public Health. Just a part-time consulting position, but I know lots of you from other webinars that I've done. I used to do community prevention in Iowa, so my background is that I've worked in public health. I think it's for maybe 12 years now. I started out as a community prevention specialist in Northeast Iowa, and then was also director of prevention services at that agency. I also did capacity coaching and training under various prevention grants for the Department of Public Health. I worked for the CAPT until they ended their services last fall, and I also currently do training and technical assistance, both for Department of Public Health and then also for a nonprofit that administers a grant for another state's Department of Public Health that serves sites across that entire state, doing work in a little further down the continuum in substance misuse, not only prevention, but working with folks that are in recovery. So I'm really excited to get to be part of this webinar for you today. This is something that we've been talking about for a long time in Iowa as part of looking at how to really see where a community is at in terms of being ready to jump in and to do the work. I did kind of a brief question for folks that were on just ahead of the hour. But I'm curious if you want to share in the chat, if you haven't already, how many of you have already been part of doing community assessment, whether you helped with the process in any way, whether you were part of conducting surveys, scoring surveys, you were the coordinator of a project that utilized community readiness? How many of you have been part of doing this work before? And you're welcome to unmute also or share in the chat. So we've got some folks saying they've never done it before. And while everyone's getting a chance to answer, I'm going to just cover a few housekeeping things because I know sometimes it takes a minute to kind of gather your thoughts and answer. Oh, my chat disappeared. Sorry, I'm having technical difficulties here today. Julie, I'm not really sure why my chat is now not showing back up for me. Oh, there it is. Okay. Okay. Just great. I've got, no, it's not. Sorry. No, it was Zoom is being super wonky. I was just saying such nice things about Zoom before we started recording, and now it's doing crazy things. So while I give everyone a chance to respond, just a little bit of housekeeping. This meeting is being recorded. Please feel free. I'm a super informal trainer. I was just saying as we were getting started that I've worked and I've done trainings in Iowa for a super long time, and I still tend to be kind of conversational and feeling like I know everybody, even though I know there's lots of new folks on this project. So please know, at any point, would love it if you want to chime in to ask a question, make a comment. Frankly, I love it when people also want to push back on something or share a counterpoint to something, because I think the better the discussion, the better the webinar and the more people can walk away with. So please feel free to ask questions or comment in the chat box throughout, but then obviously mute when you're not speaking, because it's helpful to cut down on the background noise. So first, I just want to give you a brief overview, thinking about the process as a whole. And I know this will be review for some, and for some folks, it's still kind of thinking about how all of these things integrate and fit together. So I wanted to just kind of take a step back to really look at the bigger picture and think about why we're even doing this. And so when we think about IPN and how you're all approaching the work at this point, everything that we're doing is really grounded in the SPIF, and that it's all about, being this dynamic process that we and this kind of circular process that we start with assessment, we move to capacity, then to planning, then to implementation, then to evaluation, knowing that sustainability and cultural competence are embedded in all of those steps and everything we do. But we also know that sometimes we, as we are moving in that fashion, you know, around the circle, sometimes we start with assessment and realize that we really need to build a little bit more capacity before we can get access to the data that we need, or we know that we need a few more people on board. Sometimes we get to the planning stage and realize that there's a piece of assessment data that would have been really helpful in making a decision, and we need to go back and collect it. And so, you know, what's really interesting about the SPIF is that there's also this ability to move forward through the steps, knowing that sometimes you move backwards, sometimes you then move forward again, and then you go back to a previous step, and that it's really designed and intended to be utilized in that way. But bearing in mind that the assessment and the capacity pieces, I really feel like are the foundation of the whole project, that doing a really thorough assessment and ensuring that you have evaluated the capacity of your community and come up with a plan for how to build capacity through the project, that those two pieces are really what enable you to do to make data-driven decisions, to do really good planning, and to ensure that change will happen. I think what's interesting with thinking about community readiness is I almost find community readiness to be like kind of right at the intersection between assessment and capacity. It's considered part of the assessment step, but it's also really about assessing your capacity. It's about assessing where the community is at in their ability to recognize the priority issues that you're focusing on are a problem. It's about assessing how much knowledge there is, how much effort there is already, how ready people are to engage in the efforts that you are going to be planning and then implementing. So I kind of see it right at sort of the end of assessment and the beginning of capacity when you look at the steps themselves. Everything that we do, obviously, when we look at prevention planning, it comes back to this logic model, and this is a newer version of the logic model that we've been using, I think, for like the past year or two, that really better kind of conceptualizes thinking through how we make an impact on the priority problem. You know, the consumption piece tells us why we even care, the consequence piece tells us why we even care about the problem. If there weren't consequences, then the problem wouldn't be a problem. Consumption helps us start thinking about who's being impacted by the problem, and looking at consumption and consequences together lets us know who's being impacted and who's being impacted the most severely. So we have the consumption and consequences down the one side of the logic model, and that those are really, as you're identifying the priority problem and you're thinking about the populations that you need to target. And then as you go through the assessment process, you know, thinking about, so we know this is a problem, but why is it a problem in this particular community? And if you serve a really large service area, those could be different. You know, it could be different in one community and different in a neighboring community. And so, you know, we want to, as part of the assessment process, drill down the intervening variables and the underlying conditions. Why is this happening? Why really specifically is it happening here? And then once we know the why, we can match evidence-based strategies. So evidence-based strategies really impact the underlying conditions and the intervening variables, and then those in turn make an impact on the priority problem. And then how we know that we're making a difference is by creating short-term outcomes and then mid and long-range outcomes. Our short-term outcomes show us that more immediate impact on the intervening variables and underlying conditions. Our long-term outcomes show us how doing that work over time will then have an impact on the priority problem. So I'm curious if anyone has a thought about where community readiness assessments fall in thinking about this logic model. Anybody want to unmute or share in the chat if you have an idea of where what this piece kind of informs when you look at this logic model? Anybody? Or kind of, or how you see it fitting in. I shouldn't make it seem like there's a totally like right or wrong answer. So where I really see it, oops, great. Public perception or misinformation of the problem. Yeah, great. That's really helpful, Joy. And then where do you see that fitting in? Do you have a thought about where that kind of fits in with how we are doing the work connected to the logic model? So maybe my question is a little bit confusing. So where I really see this fitting in, you know, I always like to bring it back to the logic and kind of distill it down to remembering why we're doing what we're doing. You know, why do we go through this really good assessment? We go through this really good assessment because identifying, you know, all of this hinges on having identified the right intervening variables and underlying conditions. You know, if we look at a community where we know underage drinking, where we've identified underage drinking as a priority problem, there could be a lot of reasons behind that. It could be because retailers don't know how to check IDs and aren't refusing sales, or it could be because there's near peers in the community that are buying for younger peers. There could be a lot of reasons that's happening, and knowing what the reason is that's what that underlying why is that it's happening is what lets you match the best evidence-based strategy. But matching those strategies is also about what's going to work in your community. And so that's about assessing your community readiness and assessing your capacity. And so we really, as part of this assessment process, you know, you're going to use your community assessment workbook, and you're really going to look at starting to drill this down. You're going to say, you know, what does this consumption data tell us? What does the consequence data tell us? Like, who do we need to be really looking at? What are the underlying things that are driving this problem? And you're going to identify those intervening variables and underlying conditions. But as you move then from doing that to matching evidence-based strategies, you need to also think about these other pieces. How aware is our community that this is a problem, and how ready are they to provide the resources that we need, to have the expertise that we're going to need to do this, to buy into what we're doing, to sign up for the parenting programs, to get enough people to come to beverage server training, whatever it might be. Looking at community readiness, and further down the road also looking at the feasibility of, you know, what is the fit, what resources do we have already, who's already on board with these. Those are so key to matching the evidence-based strategy and then seeing your outcomes. And so that's really where community readiness falls, and why we talk about it at this point in the process. Does that make sense, or does anybody have a question about that? And Joy, I appreciate saying, like, you know what the priority is in the minds of the public, but engaging with them that if they think a problem is worth solving. I think that's great. Absolutely. Anybody, does this make sense? Or anybody have any questions about this? I'm trying to make it less confusing and not more, in terms of just like thinking about how this kind of fits into the why are we even doing this? Okay. So, and then also just a reminder, when we talk about priority areas for IPN, what we're talking about is adult heavy drinking, and that's really going to focus on those ages of 25 to 65. Youth marijuana use, ages 12 to 20. Adult prescription medication misuse, ages 65 and older. I think that says older. I can't see it on mine. Yep, 65 and older. And adult problem gambling, ages 21 and over. And then youth tobacco use, which is ages 12 to 18. So here we are, thinking about assessing community readiness. Community readiness is really about a community's willingness to engage in and support prevention efforts, as well as the availability of skills and resources within that community. And so looking back, it looks like, I appreciate everybody that shared in the chat. We've got a lot of people that they've never done this before. A few people that say they've maybe done a little bit, or they've done some. I would love if anybody wants to unmute, or if you want to share in the chat and just tell a little bit about what that experience was like for you. So if you've done community readiness before, what did you think of it? Was it hard? Was it easy? Did you feel like it gave you really good information? Do you think that there were things that you did that maybe weren't as helpful? Like, really open-ended question here of just what was that experience like for you, for those of you that have done it before?
Say, this is Christy. I enjoyed the readiness process, especially in doing those interviews and just hearing all of the answers and being very practiced to not have a response, but just to kind of pick up on what they're saying. I always had really great luck with talking with people and getting them to participate. I never had anyone that was crabby about talking with me, I guess is what I'm saying. So I found it interesting. My background in sociology probably contributes to that too, but I always thought it was fun.
Great. No, hey, that's great to know. I mean, not like walking into this, if you haven't done it before, that it sounds like you actually enjoyed the process and that the folks that you were interviewing didn't feel really burdened by it, and so it was enjoyable from both sides, it sounds like. So that's really helpful. Thank you, Christy. Hannah's saying it gives good qualitative data, but it can take a long time. Kristen says it takes a lot of work, but you're able to get some really good information. It was also helpful to get viewpoints from outside of our prevention window and see what the community thought. Yeah, there's a lot of value in that, Kristen. Thank you. Anybody else want to jump in and just share what their experience has been with doing this? Okay. So we're going to talk the nuts and bolts of doing this in terms of conducting the assessment, but just in thinking about it overall, utilizing community readiness really lets you assess the community's readiness for change. It gives you an opportunity to be planful in thinking about how you want to increase community capacity around that, and helps create a climate that makes change possible. It's really interesting. So the particular, there's a couple of different community readiness models out there, but the particular one that Iowa uses is the triethnic community readiness model, and it comes from the Triethnic Center for Prevention Research at Colorado State. These three folks that are listed down here are really the leaders in having created and done that work at Colorado State. There's a couple, if you're kind of a geek like me and you're really interested, they've written a couple really interesting articles about it that talk about the background of it. I think one of the ones that I read, I think that really spoke to me about it was talking about one of the places this originally came from was when they had done some work in a couple of, they had like a project, and they were getting ready they wanted to launch an education and a media campaign in a whole bunch of different communities. And they went out and they did that work, and they were really surprised to see that in some communities that work really took off and had good results, and in other communities it just went nowhere. And they were trying to figure out why that was, because it was the same information. And what they realized in going back and kind of doing this initial kind of crude community readiness that they were utilizing at the time was that it was really all about the difference, because the materials were the same and the information was the same, that the difference was in the communities themselves. And it really was about whether they even recognized that the problem was a problem, if they were resistant to wanting to talk about it, if they were kind of in denial, like maybe they knew that this was a problem, but they didn't think it was a problem in their community. And that really then made an impact on what the results of this campaign were. And so the result of all of this was this model that they've created that really lets you look at community readiness and use it in this way to say, okay, where is this community in terms of being, ready to make some change, and how can we move them along that continuum, and how can we help create a climate that makes change possible? And what's interesting, we'll look at the stages of readiness in a few minutes. They rank those stages of readiness from 1 to 10. But what's interesting is it's not just about the specific stage that they're in. It's about measuring it across these dimensions. It's not just like, oh, this community's at a 5. That's such a blanket that's such a blanket kind of statement. It's really about looking within the survey at each of these individual dimensions of readiness. Thinking about, knowledge of community efforts. How much does the community know about the current problems and activities? What's leadership's attitude in the community toward addressing the issue? What's the community's attitude toward addressing the issue? How much does the community already know about the issue? And what are the resources that are being used or could be used to address this issue? As you're doing the scoring, each of these dimensions actually receives their own community readiness score in addition to coming up with an overall readiness score. And this level of detail to the planning can really help you kind of hone in on the specifics of where you need to be looking at your readiness and increasing capacity. Just like everything that we do with the SPIF, also thinking about that you always want to do everything with cultural competence in mind, because again, when you think about kind of moving from that, when you think about that logic model and you've identified your intervening variables and underlying conditions, and now you're matching strategies, the culture of your community has a real impact on that. And so in everything you do right from the beginning, you want to think about how to make sure that you're making a fully informed decision. And so involving representatives across sectors, collecting, interpreting, and sharing information, making sure that you're considering and involving who's most impacted by the priority problem, disparate populations, you're looking at community demographics, not just who's at the table, but who's really, what does your community makeup really look like? Think beyond race and ethnicity. Those are absolutely important, but also socioeconomic status or disability status or gender, or all of these things can, when you're looking at your data, there may be some disparities between how someone is being impacted, whether it's in how they're consuming, whether it's in the consequences that they're suffering. And so these are things to not only for you not only to look at as a coalition and as a group with your data, but to make sure that you've got members of those different communities to also help you be looking at it and to say, hey, I think that this part of the community might be really underrepresented here, or we didn't think about this, or the way this question is asked, I have some concerns that this portion of the population maybe isn't looking at that the same way that you're now interpreting it. Having those folks at the table right from the beginning is going to let you build that more solid foundation that you then are building your planning on top of later. Your implementation then goes on top of later. And so being able to do this at the outset is so important to getting where you want to get later with your income, with your outcomes. So what do you think will be some particular considerations for the communities that you serve? So share in the chat or unmute just in how far you've gotten so far with thinking about assessment, or just knowing that your community that you work in, or even just thinking about your community that you live in. What do you think will be some of the considerations as you work on your community assessment, and also specifically as you're conducting community readiness? What are the things that you think cultural considerations that you need to make sure that you're taking into account, or that you need to make sure there are folks that you have at the table? And there's no wrong answers. Just throw some, share in the chat, unmute. What do you think will be some considerations specific to the county that you work in or the county that you live in? Yeah, rural versus larger city areas. Yep. So having representation from both, having a diverse community and thinking ahead about having interpreters. Yep. Small towns getting lost in the data from the larger communities. So thinking about, how are you going to pull that out to look at it separately, to look at it comparatively, to make sure that you're not just looking at county data, but when possible, you're looking at community level data. Absolutely. Having a large native population. Yep. And so thinking about culturally, so if tobacco is one of your, talking about not demonizing tobacco in general, focus on the misuse because it's a sacred item when you're working within the culture of that community. Absolutely. What else? So keep them coming if you've got some more. So let's move ahead now a little bit. So when you do the survey, what you're going to end up with at the end is the stage of readiness for each of those dimensions that we just previously looked at. So looking at leadership, looking at community climate, all of those, you're going to get a stage of readiness for each, and then you're also going to get an overall stage of readiness. So no awareness is, really what it says, that the community has no knowledge of local efforts. Now, this doesn't mean that your coalition hasn't been there for, 20 years and has been making some really good things happen. But it may be that people don't know that it exists, that there's efforts that are already happening, and having people know about it and be able to engage with it really makes a huge difference. So at this level, community has no knowledge about local efforts. Leadership thinks the issue isn't really much of a concern, or the community believes it's not a concern. Denial and resistance say they either think that it's not a concern in their community or that it can't or shouldn't be addressed. Someone brought this up earlier, that they might have misconceptions or incorrect knowledge at this stage, or only a few members have knowledge about the issue. They're not supportive of using available resources at this point. Vague awareness. A few community members have at least heard about local efforts, but they know little about them. They think the issue might be of concern in the community, but they show no immediate motivation to act. Maybe they have only vague knowledge about the issue, and that there are limited identified resources to use. In pre-planning, some community members have at least heard about local efforts, but they don't know a lot about them. They're starting to acknowledge that the issue is concerned, but they might have limited knowledge about it, and that there's, at this point, still limited resources to address the issue. In preparation, most community members at this point have at least heard about local efforts. Leadership is actively supportive of continuing or improving on current efforts. Folks are starting to say, we're concerned about this and we want to do something about it. There starts to be some basic knowledge and some resources dedicated. As you move further down the line here, initiation, most community members that have at least basic knowledge. Leadership in that community plays a key role in being involved. Folks are starting to say this is really our responsibility. We're aware that it happens here and we want to take some responsibility for it, and there's starting to be more resources for it. At stabilization, most community members have more than basic knowledge. They're actively leadership is actively involved. People are starting to say we have taken responsibility, and there's ongoing community involvement in the issue. And that there's an expectation of continuous support for the issue at that point. At confirmation and expansion, most community members have considerable knowledge of community efforts. Leadership in that community is playing a key role in expanding and improving efforts. The majority of the community strongly supports the need for efforts, and most people have more than kind of a basic knowledge. They have significant knowledge about the local prevalence, and that there's continuous support, and people are looking for additional support. And then when you get to stage 9, it's a really high level of community ownership. Most people in the community have considerable and detailed knowledge of local efforts. Leadership is continually reviewing evaluation, what's going on, what does the problem look like now, what are we going to do next. They have detailed knowledge about the issue and significant knowledge about local prevalence. They're really at this point saying this is important, and it's really become ingrained in what we do. And so as you're assessing the readiness, you're looking at where it is now, and then thinking about how you are going to move it. How are you going to move it from, if you start out at a 2, what is this community going to need to really get involved and be ready to start planning and doing the things that are in the pre-planning stage? And we're going to talk about that. We'll talk about that a little bit more as we go. Any questions about the stages themselves? Before we kind of move into the doing part here. Anybody have a question at this point? Okay. So this is really the process in a nutshell. You need to start out by determining resource and capacity needs. You're going to need to identify and engage the key respondents, so the people that will actually be interviewed. You want to make sure that you're selecting and training your interviews and scorers. You're going to conduct those interviews. You're going to score the interviews to determine readiness levels, and then based on that, develop your strategies, and then that will lead to outcomes in your community. So let's look at each of those just a little bit closer. So, as I said, the assessment and capacity are really the foundation of all this. And so starting out by thinking, what are the resources and capacities you need to do this? Thinking about who has connections, who are you going to choose to be interviewed? Who has connections to those respondents? So right at the beginning, do you have enough people around your table as you're even thinking about starting this process? Are there going to be enough people to conduct the interviews, to score the interviews? When you're thinking about who you're going to ask, are there people around the table that can say, oh yeah, I can ask that person to be involved? When you are getting ready to think about conducting the interviews, you're going to do 6 interviews, and we're going to talk about this piece again. It's important, so I thought I'd put it in a couple places. You're going to do 6 interviews for each priority area. And so each priority area is going to be its own set of surveys that you're going to look at. And then you're going to get a score for each of those priority areas. And so you're going to do 6 interviews for each priority area, and you need to make sure that you're doing them within each county in your service area, which is really important because, like we said, sometimes a smaller county and a larger county can be a big difference. Sometimes what's going on in one county can be so different than the county right next door to it. And then think about who also has the capacity to train the interviews and the scorers. Is it going to be the coordinator for that county that attended this training and read through the community readiness handbook? The link to which you're going to get your own assessment workbook, assessment guidance from IDPH. And then there's a link on the slide that I showed for the Triethnic Community Readiness. There's a link to download the handbook that really outlines each step of this process. So will you be the person who's providing training to those that have selected to do the interviews and those that have selected to do the scoring? Or is there someone else in your community that's done this before that would be a great fit to do that? So really think about, before you even get started, what kind of resource and capacity needs are you going to have to bring around your table? And then you need to identify who's going to be interviewed. So 6 people per priority area, respondents in each county of the service area. You want to make sure, as we said, that you're going to be looking at including, when you're thinking about who are we going to interview, you want to think about members of the disparate populations that you've identified and looking at your data, or underrepresented groups. You always want to be looking at these sectors, and so having some diversity across these sectors: schools and universities, city and county government, law enforcement and probation, social services, health and medical professionals, youth, spiritual, mental health services, and other community folks. The key respondent interviews are qualitative interviews with people who really know what's going on in the community. thinking about that it's about people that are like in the know in the community, not necessarily that they know about the priority problem. And you really want to think about who that might be. They're people that have particular knowledge and understanding and really can give you that insight. And so they could be community leaders, professionals, residents, whoever has firsthand knowledge about the community. Oops, my computer is doing weird things. Sorry, guys. A couple of do's and don'ts. We definitely don't want to think about not asking the same. So these are the sorry, this is who you do want to ask. And then we don't want you to ask the same people for all priorities. So you can't, ask someone from the sheriff's department and do an interview about underage drinking and go through all the questions and then say, great, let's set that aside and now let's interview you and ask you all the questions around problem gambling. They can't be the same people for the same priorities. They should not be, you don't want to be preaching to the choir on this one. So they should not be current substance abuse prevention focused coalition or subcommittee members. So not somebody who's on your coalition, not somebody who's on the tobacco coalition. You want it to be folks that have knowledge of the larger community, and they can't be somebody who's directly subcontracted to provide services for the project. Anybody have questions about either of these as far as like who not to ask and who you really should be thinking about looking at? Not yet. Okay. So as you're thinking about who you need to interview, just kind of in my 2 cents here on engaging key respondents. So work with your coalition, work with your other partners and stakeholders to brainstorm a list of who potentially could respond. So we know, we serve 2 counties, so we know that we're going to need people from each of those counties to be participating. We know that there's 6 priority areas and there's 6 people that need to be interviewed for each. So let's make a big long list of potential respondents for each of those priority areas. And then find some connections, who on your coalition already knows some of the people that are listed and can make the ask. It shouldn't be the coordinator doing all of the work. This is a great way to build capacity right from the beginning of your project, that the other folks that are engaged in your coalition, engaged in your efforts, understand how to do this and why we're doing it, and are involved right from the beginning and feeling connected and engaged in the process. And so for them then to be the ones to make the ask, what's the purpose of what we're doing? We're doing this assessment because we want to find out how aware the community is about the problems that we're working on, how ready they are to get engaged and take action on it. We're asking you because you're a member of the local police department and we feel like you have a really unique insight into what you see going on, and we'd love to have you participate. And here's what I'm asking you for. I'm asking you to talk on the phone with me for just an hour, and your results will be kept anonymous, and I'll just ask you the questions and take down your responses, and we would really appreciate it. The interviews themselves will happen in person or over the phone. It's really interesting. There's some pros and cons to both. And I don't know if folks who have done this before have any thoughts to chime in. There's, if you look at the Community Readiness Handbook, it actually says that it's often best to do these by phone when feasible. When the interviews are done in person, there can be a greater tendency of respondents to answer questions in a manner that's going to be viewed favorably by the interviewer. They're looking at your face and your body language, and they may kind of be crafting their response based on the reaction that you're having. And there might also be a greater likelihood that the person interviewing is going to react verbally or with their body language in some way. But on the other hand, sometimes on the phone, people will actually expand less on an answer or provide less information. Sometimes for people, it's a little bit harder to communicate on the phone than it is in person. So think about the population that you're serving. Think about the capacity that you have to conduct these interviews. You know, how big is the area that you're looking to cover? You know, what's the burden of travel for the person that's doing the interviewing, and the logistics of making that happen. And, you know, just weigh the pros and cons of what works best for your particular community to decide that you're going to do them in person or do them over the phone. I would suggest, however, that you choose one or the other. You know, like any interview process, you want things to be really consistent. You really should have one person conducting all of the interviews per priority area. So if you can, it's great to have one person to do all 6 of those interviews if they're able, which is about a 6-hour commitment, and to do them in the same format so that there's consistency in how the questions are getting asked. And then it kind of helps compare, you know, when you're pulling everything together, you're kind of pulling apples and apples. It takes about 30 to 60 minutes per interview. They do say that potentially that you can do this with, excuse me, fewer, but it depends, you know, if it's a really small community or what the challenges might be. And so 6 is really what we're looking for. And if there's a reason that you feel strongly that there's going to be fewer interviews than that, then that requires approval from the Department of Public Health. Also consider how your answers will be captured. It can be really difficult as the interviewer to also be taking notes at the same time. And so the best way really to do it is if you can get the person's permission to record what you're doing, to record it as you're doing it, and then have someone transcribe it for you later, or you can transcribe it later, or to have a note taker. And so if you're going to go in person or you're going to be over the phone, you could also set it up so that it's on speaker, so that one person can be taking notes as the other person is asking the questions. And then also really important to think about how you're going to keep the information for future reference. Unfortunately, you know, working on a grant project that covers multiple years, sometimes the folks that are really involved in the beginning as you're doing this process aren't always the same folks that might be checking back to see where readiness is at in a couple of years or at the end of the project. And so to be able to preserve the information so that you know who was interviewed, and you have like all the information kept together so that when you go back later, you can make decisions based on that. So the information, you know, should be kept at your agency with a supervisor. You know, I would also suggest, again, that the more you can involve your coalition, the less this then resides with one person, that there will be other people who know how to do it, know why you did it. You know, keep notes too. You know, don't just, you know, hold on to the copies of the surveys or the transcribed records of the surveys, but also, you know, hold on to your notes of why you decided who you were going to interview and who you asked, and so somebody can look back and understand the process, excuse me, and the thought that went into that. During the interview, we've talked about this a little bit. During the interview, you definitely want to make sure that the interviewer is keeping the respondent on track and that they answers the questions. I did some scoring for some community readiness, and it was really challenging at one point because there were some very short answers that made it difficult to score, like a 1 or 2 word answer, or somebody kind of like started to answer the question and then went off on a tangent talking about something else, and the interview never kind of brought them back to make sure that they fully answered the question. So you want to, as the interviewer, make sure as you're reading the question. So let me look at an example here. You know, are there any efforts in Dubuque County that address problem gambling? And so if the person says yes, it's a little hard to score just based on yes. And so, you know, oh, well, can you tell me a little bit more about them? Can you tell me some more about that? Or somebody might say, yes, there are. Oh my gosh. And this, and I can't believe that they, we're still allowing smoking in this one part of the casino, and this is a big concern. And they sort of go on this whole tangent about something else. And again, you realize that they never, really expounded on their answer to show if there were really significant efforts happening in the community and that people were aware of them. So make sure that the interviewer knows to keep them on track, ensure that the question is actually answered, and prompt for more detail when needed. Also, if somebody is really kind of going on a tangent or overly giving, more information that you need, they could also feel comfortable to say, like, great, that was really helpful. I want to be really respectful of your time, so I'm going to move on to the next question now. Interestingly, they also ask that you do not rephrase the interviewee's answer. You don't want to be introducing bias into this, or having them trying to answer in a way that they think you want them to answer. And so just asking the question, you can ask for some more detail, but then taking the answer as it exists. And so not saying, oh, so what you're trying to say is, XYZ, that might then prompt them to change their answer. And so, again, like, oh, can you tell me a little bit more about that? I'm not sure if I know what you mean. Anybody have any questions about the interview process? Looking to see if I missed, if I've caught everything in my notes also. Oh, do not send the questions beforehand, because you really want them, you don't want them to research it or look into it beforehand. You want to get this like honest in the moment response about what they're already aware of. You do want to make sure that they're going to be in a space and a place that you conduct this 30 to 60 minute interview. If they, sometimes it happens that you get ready to conduct it and somebody has said, great, I'm happy to do that. You call them on the phone and then they say, you know what, yep, I can still do it, but I've only got 25 minutes. I absolutely in that case would say, oh, you know what, I don't want this to feel rushed. I definitely want to make sure that we have enough time so that you can answer all the questions. Let's find a time to reschedule. It's kind of like doing school-based programming when it's supposed to be a 45-minute session, to really, then have 45 minutes to do it, and not try to squeeze it into 20. So any other questions about the interviewing? Okay, so the interviews are conducted. So you've gone, your person has gone out. They've interviewed 6 different people for your priority area, and then it's time to come back and to score them. And so you want to have 2 scorers for each for each survey. And again, ideally, what you'd really like to do is have the 2 scorers for each. When it says per survey, it means each like set of 6 surveys. So each score is then going to work independently. So I'm going to sit down with these 6 interviews. The other scorer is going to sit down with the same 6 interviews, and we're each going to go through, and there's a really great, in the Community Readiness Handbook are all the questions, and also a guide to the scoring of like what you're looking for, and then how to assign a number score for each one and how to calculate that. So I'm going to look through mine. That person is going to look through theirs. We're going to do that totally separately and independently. Then we're going to come together to reach consensus. And this is a super interesting part of the process. And I've been part of doing this part of the process. That, when you're doing the scoring, you're looking for particular things. And so when I did the scoring, I was kind of going through and making notes for myself of, I would circle something in the interview and then I would give it a score, and I would, kind of highlight that I had scored it, as a 3 because I saw these couple things, but, there didn't seem to be evidence of, some other things. when the two people meet to do the scoring, it really should be a conversation for them to come to consensus. It shouldn't be, well, I scored this a 3 and that person scored it a 5, so we'll just call it a 4 and call it a day. It might be that I say, well, I called it a 3 because I noticed this and this, but that was all I really saw. And the person who scored it a 5 might say, yeah, but I saw right here they said this, and that made me think it should be a 5. And I might say, oh my gosh, you know what? I didn't notice that the first time. I think you're right. I think it should be a 5. Or the other person might say, oh, you know what? You're right. That's maybe not what I was thinking. And I think it should be a 3. And so it's really important to work together to come to consensus on those scores. And then you use those scores to calculate the stage of readiness, again, for each of those dimensions, as well as an overall score. And then it's also can be really helpful to highlight impressions, unique outcomes, and qualifying statements. And so as you're then using this as a tool, you may also want to pull out, if there's a particular quote or there's an impression that seems really helpful in sharing back with the coalition or sharing with the community something about this process. Just be very careful when you do it to ensure that it's not something that is able to be attributed to someone specific. Because people should be assured in doing the being a respondent that their information will be kept confidential. So, if you only interview one law enforcement officer out of all the surveys and your coalition knows that you did that, you don't want to attribute it to this quote to say, a law enforcement officer who completed the survey said XYZ, because it's going to be really easy to know that that was the person. There's some really nice detailed instructions for scoring the interviews in the Community Readiness Handbook. It's going to go through these also really quickly. These are super detailed, so I didn't put them all on the slide, but they really go step by step through the process. They talk about like, hey, one thing you can do is have some different colored highlighters, one for each dimension. So as you go through, you can mark things different colors. Set your blank scoring sheet up, read through it in its entirety, and then go back and start scoring the dimensions. Start with this, dimension, and then move to this dimension. So I would definitely suggest, I think it's a little more in depth that we're going to get to today, but I would look at the detailed instructions that are going to be in the assessment guide specific to Iowa that you're going to get, and also to look through the really specific suggestions that they make in the Community Readiness Handbook. Anybody have any questions about this piece? So we've talked about the choosing key respondents. We've talked about conducting the interviews. We've talked about scoring the interviews. Anyone have any questions? Yeah, hi.
Hi. And I apologize if I just missed it, but I know there are a lot of guidelines about who we need to identify to do the interviews. Mm-hmm. Did you speak about who needs to do the scoring?
No, good question. So really, you just need 2 scorers for each of your priority areas. So that's entirely up to your coalition or to you to decide who has the time and the interest. I would say, I didn't put it on the slides. I would say, it's a significant commitment in terms of it probably will take you about an hour, I think, to score each survey individually. So that's 6 hours. And then you need to meet to come to consensus with the other score. So that's a couple of hours. Plus you want them to do some going through of it and training beforehand. You really want to walk through the handbook with them, make sure that they understand the process, that they understand how to do the scoring, how to calculate it. So, I would estimate that you're probably asking someone for like an 8 to 10 hour commitment. And that you're going to need, if you're asking, and you could have the same people score multiple priority areas. That's fine. Frankly, it'd be great if you had like 2 scorers that would do a whole bunch of them for you, but that's also a lot of hours to ask of somebody. But if you need 2 scorers per survey, and there's 6 priority areas, that's going to be potentially 12 people to do the scoring for you, but you could ask people to score multiple ones, and that would be fine. Did that answer your question?
Yeah, partially. I mean, I've got other things in my head, like, do the scorers need to live in the same county that they're scoring?
Nope. No, and really, I mean, actually, the scorers aren't they're not doing any, they shouldn't be doing any interpretation in terms of, like, it would not be important at all to have knowledge of who the people were or of the county. They really should literally be just going through the information right in front of them and basing it on exactly what was like transcribed and what it says. So no, they definitely don't need to live or work in the county. I mean, they actually, you know, we sometimes would ask when we had done this before, we sometimes would ask like folks that worked on other projects, or just, you know, somebody who was like a peripheral community partner that had offered to like help out with some things. They weren't necessarily like a regular super engaged coalition member, but they were somebody that was interested in like helping out with our efforts, and were happy. They couldn't always come to like meetings every month, but they were happy to help with a discrete task. And so to say like, hey, here's something that we really need some people to help with, you know, it's going to take 10 hours over the next couple of months to do, or you know, whatever it might be. Is this something you could help us out with? Ooh, Joy has a great question, and I feel like this came up with PFS, to ask if the interviewers have to be over 18 or if you could use student leadership. Um, Julie, I feel like maybe, I don't know if you want to jump in and answer this. I know that there were some considerations around, because the, you know, around the, what, depending on what the priority area was, or depending on like, you know, needing to get permission and things like that. But Julie, what do you think about that?
I'm trying to remember, think back to whether we've allowed that in the past. Certainly, I know some of our contractors have worked with college students to score the surveys. You just want to make sure that folks who are scoring have a good understanding of this process. I think that might be something we need to talk about internally, instead of making a decision right here about that. If you're using middle school or high school students to score, so that I will make a note of that and we can follow up.
And she was asking about interviewers also. Let's talk about it, because I also would have some concern. We can all talk about it now too. Like, if you guys have some feelings about it and you want to help like contribute to the conversation, that, you know, then is for Julie to make a determination. I guess I would throw in that I might have some concerns also if having someone who was in high school do the interviews, that I might be concerned that it might change somebody's answer, that they might be like editing themselves, or answering a question in a different way if it was a high school student that was asking as opposed to an adult. But that also seems a little bit, I don't know what the term is. My son always teases me for saying genderist if I say something that's like, you know, so ageist, maybe, is that the word I want? So I don't know. What are other people's thoughts about using high school students, or other people's experience in using high school students to do this process? Joy, is there a particular reason that you asked the question? Okay, great. Just thinking about resources, which I can totally appreciate. So, so Julie, you have that as a question to kind of go back and mull over, and then you'll provide some guidance later.
I wrote it down, so we will follow up with some next steps regarding that. But thanks for the question, Joy.
Great, thank you. Any other questions around interviewing, around who the respondents should be, around conducting the interviews, around scoring the interviews? Okay. And obviously keep them coming, certainly. And then once you are finished, you will get a score on each dimension that shows where each community is, or each county is, on that scale of readiness from 1 to 9. And so then you can think about, how do you match what you're going to do, or how does that inform what you're going to do? And so you want to be able to meet the community where they're at. You want to think about where to start. Are people even aware that this is an issue? Is it that they're aware, but they don't necessarily think it's super important? Are they aware of it, but they just don't know what to do next about it? And then also think specifically about whose readiness you need to raise. This is also, it's an interesting thing to think about, because thinking about raising an entire county's awareness can really be, that's a long process, and it might be beyond the scope of the specific work that you're doing on this project. And yet we know that raising community readiness really makes an impact on the work that we're going to do. And so being able to also then think about whose readiness do you need to raise? Whose capacity are you going to need to build? Is it that you're going to need specific sectors to be aware and engaged and offering resources and time and energy to this? Is it that you're going to need specific decision makers or gatekeepers? Are you anticipating that you're going to do work with, local policymakers? And so so if your community and your leadership in your community is at a really low stage of awareness, then starting by increasing their awareness, making sure that they know about the problem, they know why the concern is, they know what your assessment data shows, those are going to be really important. If you're thinking about doing work with the school district, whose readiness really needs to be initially raised to get them on board, to look at being able to choose a strategy that would be implemented in the school or in partnership with the school? Is it coming out, looking at your data, that it's really about parents in your community not knowing the consequences or not understanding the dangers of providing to youth? So do you really need to think about how you're going to raise the readiness of parents of middle schoolers in your community? Those are really specific things that can then let you target and tailor your messages. It can let you think about, when you look through the community readiness handbook, they talk about in those early stages of readiness, if there's no awareness or there's denial, then small group meetings and one-on-one meetings and taking somebody to coffee or going to like a service organization, that those can be ways to kind of get in at the ground level. But think about that in a more targeted manner. If what we really need is to raise the readiness of middle school parents in our community, that gives us a place to start. We're not just spending all of our time going to one-time presentations or one-time meetings and talking about why this is an issue. We're going right to that group that is really core to looking at the consumption of the consequences, looking at the why here, that we're going to that group. And then, so we're going then instead to the PTA or this particular, soccer club or whatever it might be. And we're saying, okay, we want you to understand what we're seeing, why it's concerning, what kind of resources we need, and how you in particular can be involved. That's going to make a huge impact. So does anybody have any questions about raising targeted readiness, or about how maybe you've done this already in a previous project? Okay, well, I've got a few discussion prompts that I had put in here at the end. we've pretty much covered most of the content at this point. So this is really your chance to just kind of think about this process and think about community readiness in particular to the IPN project. And so I'm curious how you see that this process might be different than when you've done this in the past. So maybe you've done it for PFS, maybe you did it a million years ago for Spiff Sig, maybe you've done it for another project. How do you see this process being different than when you've done it in the past? A lot more interviews, yeah. Julie, and I apologize. Let me stop here for just a second. Julie, did you want to talk a little bit about anything else or about the time frame? Because that might also be helpful in answering these last few discussion questions here.
So just keep in mind too that you have through the end of the state fiscal year to complete all this work. And yes, it is a lot of interviews, but we really want you to be thinking about your resources, who are some partners in this process that you could engage. Prevention supervisors, really be thinking about how you can map these out, who on your prevention team can assist, how can you get these done in kind of a systematic way from now until the end of the state fiscal year. So just keep that in mind. June 30th is the due date. The guidance document that we'll be sending out will guide you as far as what specific documents you'll need to submit to us to show the scores in the different counties on the specific priorities. So Katie, is there anything else you want to add to that? I don't know if Katie's on.
Nope, she's just unmuted.
Oh, okay.
All right, thank you. Sorry about that. No, I think what you covered is good, and just reiterating the June 30th due date, and kind of the caveat to that too is we are well aware that some contractors, may have fewer counties where some may have more. So if a contractor does complete the process before June 30th, they're more than welcome to submit the required documentation to Julie and I for review before that June 30th timeframe, and all of the details regarding submission will be included in that assessment guide here soon.
Great, thank you. And Katie or Julie, was there anything else? I know that this is a lot of information, which is, I think it's great that you guys, obviously you did like your overview webinar, they're getting this webinar, they're gonna get the assessment document. They also can go right to the Community Readiness Handbook. But is there anything that you wanna just be sure to like kind of reiterate, or like key things that you just wanna make sure that folks have in mind?
Well, I do just want to share that those priority areas that we've focused in on are because IPN is very broad. The block grant requires us to really focus in on some specific areas, but we have to serve the lifespan. So you can't do community readiness on just alcohol. You have to really focus and narrow in on a specific area so people know how to answer. Underage drinking is different than adult binge drinking, and you'll get different answers about those specific areas related to alcohol. So we are asking you to focus in on some specific elements of the priorities in the IPN project because they are so broad. And we identified those. There were a lot of discussion that we had behind the scenes about those. So we looked at what had been done in the past with some of our discretionary grants. We looked at data, emerging trends and issues that we're seeing. So that's how we identified those specific areas. And we just want to have a good grasp of the readiness regarding those priorities. Now, it doesn't mean that you can't do other types of services. It doesn't mean that those are the only things that you can do in the IPN grant. We just had to make some definitive decisions regarding this community readiness process. And so that's how those came to be. You're going to be looking at other types of data within the CAW process that'll help drive your services. So this is just one component. So this makes it a little bit unique compared to what we did in SPIFSIG or SPIFRX or PFS, because SAMHSA gave us a priority that we had to focus in on, and we already knew which substance we were focusing in on. So this makes it a little bit unique. So I just wanted to throw that out so everyone understands. You can focus on other areas, certainly with your services. Your data may show that there are different areas that you'll need to address. But as far as community readiness, we had to kind of drill down a little bit deeper, and this is how we came up with those.
And Julie, can you help me? And I apologize, you guys. Is it I copied and pasted this from what you had sent me. Is it 5 priority areas or 6? Did I miss one? Because now I don't see underage drinking. Is underage drinking one of the priority areas for this?
I think there's, Katie, are we missing any?
I'm so sorry.
No, I think
there are 5 listed.
There's 5.
There's
Okay,
5.
so I think I kept getting that confused throughout because you have to interview 6 people, but it's 5 priority areas.
Correct.
So Leslie, I'm so glad you asked me to bring that up again. I didn't want to make anybody nervous that you were missing one. So there's 5 priority areas, and here they are to answer Leslie's question. And sorry for I just pulled this over from what I was saying because I'm not working on this piece of IPN. So thank you. The confusion was definitely on my end and not on Julie and Katie's because they're on top of it. So let me go back. So we've got a couple other questions. So let me go back here. So Leslie wanted to know if there will be additional funds available to do this, was the first question.
That is something we're looking at right now. We're doing some digging behind the scenes. I can't say there's a definitive yes at this point, but that could be something that's coming down the pike. But we're in talks with our fiscal bureau right now. So just know that could be a possibility, but I can't say 100% for sure.
And then Joy is asking about thinking about those that do direct service, that she's saying, I'm going to read this first, and I wanted to share something, and then also I'm sure Julie and Katie will have something to say too. So Joy said, in regards to direct service, I assume we're to prioritize this community assessment at this point. Many of us have formed relationships through direct service, so the idea of saying we cannot visit classrooms due to the time required for this may damage some of that hard work of building relationships. Doing this plus keeping the classroom services available will stretch us pretty thin in some places. So first, I would just say, I know that it's really, I know that it's harder to do than it is to say it. So I want to acknowledge that. And what I'm about to say, which is this really should be a community coalition effort, or if you don't have a community coalition yet, as you're building a coalition and as you're pulling in partners, it definitely should not be the coordinator doing all of this for a couple of reasons. One, because you're absolutely right. When you start thinking about doing this across counties, across priority areas, this is a lot of time that would be super challenging for just a few people to do. But also it's such a huge piece of building capacity and building sustainability for utilizing the SPIF to do prevention in your communities beyond this particular funding source and the time limitation, potentially of any funding source. And so it really is ideal anyway, right from the beginning, to be pulling in coalition members and additional partners. And I'm always happy, and I'm sure Julie and Katie are happy to help if this is an area that's newer or maybe a challenge in your particular community. I'm always happy to help brainstorm and to think about who are the partners that are, that might be able to help with this? Are there other, prevention folks that you can ask? Are there people from the school district? Is there another local service agency? It really, in some ways, not having the choir, as I was answering that other question about scoring, you don't have to be super in the know and super engaged and one of the coalition members that always shows up for everything to do this work. And in some ways, that tendency to want to add something to a question or want to interpret it is actually not helpful in this process. What you literally need is someone to volunteer the time commitment required to understand how to conduct the interview, or to understand how to conduct the scoring, and to do that in a consistent in a consistent way. And so anyway, that was a really long answer to say, I understand that this is a big undertaking, but that also it really should be diffused across many volunteers and stakeholders. Julie or Katie, do you want to add something to that?
Well, I would echo what Claire said. I think this is an opportunity for you to come together as a prevention team and in partnership with your coalitions to think about how to get this process done. And I would really encourage you, like I had shared before, to map out a process, to be really systematic about how you're going to get this work done. You don't want to wait until the last minute to do this work. So if you can stretch it out amongst your team in collaboration with your coalition or other resources, it's an opportunity for you to come together and really think through how this could work. I would also say that we've not done the SPIF process through this funding stream like we've done in our discretionary grants, and I realize there are challenges, but certainly we could have written the RFP in such a way that you would just have to do SPIF and there would be no direct services happening. And I know nobody really wanted that to be the case. So we are trying to be mindful about we know that some of these pieces take time, but truly, if you work the SPIF steps, as we've said repeatedly, it's going to help drive your services. You're going to be able to focus your efforts on really where they need to be focused because you cannot do it all. So this process, even though, yes, it's a heavy lift and some of the steps are heavier than others, it's really going to help drive your services. It's going to help really focus in on where you need to be focusing because we can't do everything. Even though we're charged with serving the lifespan, there have got to be some different areas that you can hone in on in your different counties and your service area.
Yeah, and I would just add to that, I would agree with both Julie and Claire Grace, and also thinking about how you can engage your current partners, not only within the process of the strategic prevention framework, but also being very transparent with them about the direction of the grant and helping them understand the direction of IPN, and that we are using the strategic prevention framework to guide prevention services. So yes, that may change, how current services are being provided, but there's still an ample opportunity to engage them throughout the process, moving forward throughout this project period. And then also just wanted to remind individuals that in the prevention services orientation guide, we did have set like an expectation for the assessment and capacity step. So we base that off of a 1 FTE. So basically what we had carved out was, for example, a 1 FTE could spend 50% of their time at direct service, 25% for the assessment step, and 25% for the capacity step. And the thought process behind that was to really be intentional, as Julie said, that we are, taking this framework seriously and wanting to make sure that individuals are carving out enough time to successfully implement the assessment and capacity steps at the beginning of this grant. So I think there are absolutely solutions to any concerns that you may have. Definitely hear what you're saying, Joy, but just trying to think down the road of how you can engage those partners throughout this process, but also communicating to them about the direction of the project, I think would be very advantageous.
And, I would just add, I think in communicating that, bringing it back to this, which I think seems complicated, like there's all these arrows and boxes and all of that. But I think when it really distills it down, it's about thinking about how we're changing the environment and how we're having an impact on how you're going to impact the priority problem. Thinking again, bringing it back to who's really being impacted by this problem, who's suffering the most consequences, who's consuming, the most, and where and in what way. And it's this intervening variables and underlying conditions piece and matching that to the strategy that I think can be it can be challenging. The reason that you're putting time and effort into this assessment piece in the beginning is to figure out what's really driving the problem and what's the best strategy to match that. And I think it can be really challenging to prioritize the time to do that, to do that work when you're in the midst of already doing some other direct strategies. And yet being able to do that is what really then lets you have the greatest impact on your community, because it may turn out that that a particular strategy isn't in that one community really addressing what the underlying condition is. And that's really a challenge to not we have such a limited amount of time, as you're saying, like such a limited amount of time and resources and energy. And so I know that this can be an onerous and time consuming process, but in the end, doing this at the forefront and being able to say, where do we want to put our time and energy? Where do we want to be providing these direct hours and direct services in our community so that they're directly going to have the most impact on the priority problem? And so, again, I think the answer in some ways is the more you can diffuse that time by having volunteers and coalition members, but some of it is also, at this point in the process, it's just really important to prioritize the time to do that so that you ensure that as you're moving forward, what you are doing for strategies is going to have the most impact on the problem that you address. Julie or Katie, do you want to say anything else about that, or does that kind of sum it up?
I think that sums it up beautifully.
Yes,
Great,
thank you.
So Joy, that was a super long answer to your great question. I mean, it's a great question. It's a challenge to be doing both of these, and to do them well, for sure. So thanks for your question. We've got a few more minutes. So does anybody, other questions from anyone else? I'm going to just skip ahead really quick. I had a few questions that were just more like food for thought. So we don't need to answer them specifically. I want to leave more time for you guys to ask your specific questions, but for you just to think about how this might be different now than when you've done it in the past. And somebody did start to say already, it's certainly a lot more than it was when maybe we were just asking about one priority area or two priority areas. You were maybe covering just a couple of counties or one county. So think about what that means. What does it mean for needing a greater number of volunteers? What does it mean for doing some really good timelining that even though June seems super far away, maybe it's not as far away, especially if maybe you want to have, instead of having like 12 or 10 different people, needed to do the scoring, maybe you have 6 and a couple people volunteer to do a couple sets. And so they do some in February and then they do some in April. And that doesn't feel like as much of a commitment, but obviously you have to plan that, pretty far out to make that happen. So just some food for thought for you of how this might be different and what you might need to do differently because of that. Think about, again, how you're going to incorporate this into your assessment. I do think that there's a lot of value in this. And so I think it's also really important to think about from the beginning and think about with your coalition and your other stakeholders. This isn't like a standalone assessment that we do these interviews and we get the score and we turn it into IDPH and it's like, check, that was done. And at the end of the project, we'll look at it again. Really think about, like, this is a lot of time and energy to put into this. So how are you going to use it? Are you going to use pieces of it in then raising readiness? How are you going to communicate it? How are you going to let people know what you've done and why you did it and what you're going to do as a result of it? How are you going to make sure it gets revisited? How are you going to pull pieces of this and make sure they go into your community assessment plan, that they go into your capacity, that they go into your action plan or whatever it might be? So really think about, how you're going to utilize this and keep it as a living document. Obviously, of course, thinking about how you're going to ensure that the process is culturally competent. What does that mean for your particular community? And what does it mean all the way backed up from who's helping decide who's going to get interviewed, to who's doing the interviews, to who's scoring the interviews, to who's interpreting results, to who's sharing results? All of those pieces along the way that you want to be thinking about. And then what needs to happen next? What's going to happen next? What's going to happen in terms of like creating a plan and a timeline to make this happen? So just some food for thought on all of those. And then that leaves us about 5 minutes at the end here just for super open-ended, any question. You have like a really detailed question about something specific, or you have a big picture question about how this is going to work or what it's going to look like. We've got Katie and Julie on, which is great because they can answer some specific details. So now's your chance. Although you also have lots of other chances because you can always contact all of us. Do you guys really not have any questions, or is everybody just like, okay, there's 5 minutes left. I'm ready to hop off. Well, Julie and Katie and I can stay on for a couple more minutes. So if you have one more burning thing that you want to ask, please feel free to stay on and to ask it. Otherwise, I will go ahead and close the webinar unless, sorry, I should have said first, Julie or Katie, do you have anything else that you want to add or say?
Yeah, I would just echo, Claire, what you were saying, that we, Julie and I and Claire Grace have put a lot of thought into how the assessment, not only the assessment step, but also just the SPIF in general will work through IPN. And we absolutely understand that this is a time of change and probably prompts a lot of questions. So we really do encourage you all, if you have questions, to reach out to us directly. As we've said in the past, we're happy to schedule technical assistance calls or just talk through any of the processes with you all if you have those questions, because we do want to be successful with you all through this process, and we are excited to see kind of how this moves forward. So just wanted to, I guess, put that out there, that again, if you have questions, to let us know and we'll be happy to work with you.
And I would agree with that. I don't have anything else to add.
Great. Well, thanks everybody. Thank you so much for your time and your good questions, and follow up if anything comes up. And I find a lot of times also, you do a webinar and you get the information and then you start to actually do something. And then all of a sudden you're like, oh, wait a minute. Now I do have some questions about this. So please know that we didn't intend this by any means to be kind of a one and done and then send everybody off to do what they're doing. But once you get started, if you've got more questions, please feel free to reach out, because that's what we're here for. So thank you so much, and enjoy the rest of your Friday and have a great weekend.